Welcome to episode 166 of the Confidence Through Health podcast with Dr. Jeff Crippen. He is a chiropractor, nutritionist, and an author of the book Timeless Youth. And we discuss how to be healthy and how to manage your way through the health system, the healthcare system, even though it's really a disease management system and a sick care system, how to manage your way through that to become healthy if you've got an issue, if you've got a chronic issue or a disease that's crept up over time. How do you manage that? How do you become healthy after that? And what steps do you take? But also, like, how do you go about taking care of you and making you first? And that's a big piece of the puzzle, because a lot of us get medications from multiple doctors, as we discuss. And how do we understand how to make sure that we are getting the best care that we deserve and that it's going in the right direction? And we talk about different steps to be able to make sure that that happens, and how to set that roadmap and how to create the life that you want for your health, that we should all want to be healthy as we get older, so that we can do the things that we want to do with our life and not be tied to medications or a healthcare system, because we have to be checking in with our doctor so often. We want to be able to do things, and he explains it through his own life and the journey that he's gone through, which I found to be fascinating, how he went through that and learned and overcame to be able to teach others how to do it. And so it's a great episode with Dr. Jeff Crippen. So welcome, Jeff, to the Confidence Through Health podcast.
Awesome. Thank you. It's wonderful to be here. Thanks for having me, Jerry.
So I'm really excited about this conversation because, you've got a book out, Timeless Youth, and I've been reading a bit of it. And I think your message is very, not just timely from what we see going on in the world, but it's very accurate. When you look at research and what we should be doing from a human standpoint. But before we get into all of that media and stuff, tell us a little bit about who you are, what you do, and why this is a passion for you.
Yeah, absolutely. I'd love to. And thanks for the opportunity to do that. So I guess the reason I'm here today with you, and the reason I wrote the book kind of correspond, it started when I started getting headaches when I was about 6 years old. Mm-hmm. So, you have a little headache every once in a while, and it kind of gets a little worse. Eventually it becomes persistent, or it did for me. So you go see a pediatrician, children's Tylenol, children's Advil, rub a little dirt on it, right? Keep going kind of thing. And kind of pushed through that for a while. And after a year or two, if the headaches keep getting worse, and then went on to ibuprofen and some prescription stuff. And when it still wasn't getting better, they said, hey, we better get this checked out, because progressively worsening headaches in a young child that don't respond to medication is potentially a red flag symptom, right? You're looking at bad stuff causing it, right? Basically what red flag symptoms means. So I did a CT scan. They found something in my brain. They didn't know what it was. So then I did an MRI, and eventually, they found a mass about the size of a dime. For those of you who are looking at us, I'm holding up the picture, but the size of a dime. And they said turned out not to be cancerous. It turned out to be a benign arachnoid cyst is the technical term, but just think a little growth in the back of the head. And they monitored that for the next 12 years. And with MRIs, I must have done every 6 months, year and a half, did an MRI. So must have done another 10 to a dozen MRIs over that time. And it never grew. But they thought maybe this was causing the headaches. But that never fully made sense to me, because, sometimes I had the headache and sometimes I didn't. Right. Or sometimes the headache was better and sometimes it was worse, or sometimes the top part of my head and other times the base of the skull. Right. The point is the headache would change. The symptom would change, but the cyst never did. Right. So it just kind of raised something in my mind. So how could they think this thing that they can see is a cause? Right. But that never changes, but the symptoms do. So anyway, went through different doctors, orthopedists or neurosurgeons, neurologists, different drugs. You just kind of go through that whole system. And the reason I kept going through that whole system is because that's all I knew. Right. I wasn't familiar with this, with a more holistic viewpoint at that time. So went through that system for another 7-8 years and just kept getting worse and worse. And at its worst, I had a headache for 2 years. So every moment, every day, nonstop. for a couple of years. So, and that's, for those, for those listeners who have it, like when you're dealing with something, you feel like you're going through heck.
Yeah.
Right. It's tough, right? It can be some dark days. It can be some difficult days. So anyway, just eventually, after about 7-8 years of frustration, kind of with not being able to find someone that could tell me what the cause was,
right?
Forget, and they couldn't help the pain either. So I couldn't get help with the symptom or find out what the cause was. Eventually, I had to decide, on some level, I'm going to try to figure this out myself, and that was, early teens, and just kind of launched me on a journey for the last, 25 plus years of just trying to understand health. So, fast forward, I went to college. We were just talking about this a little bit, but went to college thinking I was going to do something in the business or finance side, and did an internship my first year. Didn't find it was really fulfilling. Didn't really hit that purpose for me. And so then I was thinking, well, I'm going to drop out till I figure out what my purpose was. And my parents said, maybe you shouldn't. so then I was like, okay, well, so we kind of negotiated. I go, I'll stay in for a little longer until I try to figure out what that step is for me. And meanwhile, while I'm in college, I took a class in the medical school just for fun, a physiology class. So a lot of these people in the classes with me were going to be physical therapists. They were going to be potentially going to medical school or dental school or different. I was taking it as an elective because I was interested in this. And I've really kind of enjoyed it. And everyone else was stressed out because they were worried about grades to get into med school and stuff like that. I didn't care. I was a business major at this point. So none of it mattered to me. I was just interested.
Yeah.
And then I kind of thought, that may be a sign, that it was something I was studying just for fun. It was an elective for me.
Yeah.
So I ended up deciding to go to the chiropractic school and focus in nutrition. And anyway, I've been in practice for about 11 years since then. It's chiropractic wellness. And so we do a lot of nutrition. We have some yoga and some massage as part of the clinic here. And then I also really combined a lot of kind of that wholeness, the part of that holism, that spirit, mind, body, through some of the coaching aspect, recognizing that, what I learned is that I got into the health side because there's a lot that it just killed me to see kids going through what I went through. I have a lot of empathy for people going through or suffering after I kind of lived that through, 10 years of my life, and, just had to deal with, had the opportunity to deal with some of the hardship and difficulty with that. So I decided I want to do that to help others. And then I realized there's more than just health stopping someone from living, their best life. There can be shocks or emotional trauma or hardships. So, and then I realized those can affect health. So then for the last 10, 11 years, I've been studying that as well, actually since 2009. So coming up on 14 years, studying that as well to kind of combine those into one, recognizing those two go together. So that's kind of who I am and how I end up here. And then the book ends up being, basically I'm writing this to people who are like me when I was a kid, or people who are going through the medical system and frustrated, or they may have something like chronic fatigue or an autoimmune disease, and the doctors are treating the symptoms, but they don't really feel heard or don't really feel understood. And they're just fighting that system. It's what would I want to know when I was at that point? And there's only so many people I can see here in the clinic, and basically wanted to be able to help more people communicate that message too. So that's who I wrote the book for. I wrote it for the people who are struggling with their health. They know there's a better way. They've had glimpses of it, but they read a book and it's well, for headache, you should do this, or you should do this or do this. I mean, people telling me, oh, caffeine's good for your headaches. I was I was 6. I don't drink coffee. Then they're like, oh, but you should. Then you're caffeine can cause the headaches. So it's I'm still 6. I still don't drink coffee, right? Either way. Or the same thing with red wine. Some people say red wine's good for headaches. Some people say red wine's causing headaches. Yeah. Either way, I was underage. I was 12. I'm not drinking red wine. Yeah. So anyway, you read the books and it's there's a lot of do this, not this, or here's 8 different foods or 8 different supplements that could be helpful, which is good. But, you and I were talking just as we got started, without understanding the individual and who the patient is. Yeah. There's a lot there. So that's some of what led me, sent me here today, and somewhat led me to write this book that we're talking about today. It's so,
well, one of the things that you just mentioned is that, there are so many things out there, right? And it's okay, how do I know? And I think that a lot of people understand this but they don't go deep enough to truly like look at it and go, oh, okay, yeah. They see it and they go like, but then they get caught up with, oh, but this made that person feel better, right? This made my friend lose weight, or this made my friend feel better, or got rid of their headache or their depression or whatever.
Sure.
And it's like, let me try that, but it didn't work for me. Like, and I mean, we all know people that have had that kind of experience in one way or another with life. And it's like, it is because it's you have to look at where you came from. What are all the different things that happened to you?
Yeah.
In part of it's genes, but part of it's environment. And part of it is, like you were saying, shock and trauma is like what things have happened to you that maybe you dealt with or maybe you didn't deal with.
Sure.
That are still in there, right?
Yeah. I mean, I think absolutely. I mean, that idea of you can't know, there's a quote, I'm drawing a blank on who said it. The guy about 100 years ago, he said, you can't know what sort of disease a person has without knowing what sort of person has the disease.
Oh,
right.
Yeah.
It's just the power of, you have to look at, understand that person right in front of you, because let's take headaches, for example. If I'm, a woman around my cycle, that could be one cause of the headache. If I'm a high school football player who just took a shot, that could be a different cause of a headache. If I am a college student early on a Sunday morning, there could be a different cause of a headache there.
Right.
Right. I mean, you could start to go through, if I'm somebody with a lot of sinus issues and I've got, post-nasal drip and pain, that could be another cause of headache. So you just look at something as basic as headaches, and the medical solution, or, the simple drug solution is take Tylenol or take Advil or take all of those things. Well, none of those are caused by an Advil or Tylenol deficiency. So it's easy to treat the symptom of causing the head pain. But if you really want to understand the cause of what that is, that opens up a whole nother can of worms, because there are dozens and dozens different of causes for something as simple as a headache. Forget heart disease or elevated cholesterol numbers or kidney function. You can go through all the different parts of the body, but the ability to see that whole person and how the medical system, we go to doctor, we go to, a general practitioner typically. And then if we have a real issue, he'll refer us to someone who's a little more specialized. Like I went to an orthopedist, but maybe you'll go to an orthopedic surgeon. They're more specialized, and maybe you do an orthopedic surgeon who specializes in the wrist. right. The further you go in that system, the more specialized it gets. And they have tremendous knowledge, and, the medical system has tremendous knowledge and tremendous technology. But as you keep going more and more specialized and pushing that way, it's easy to lose sight of the whole. Right. It's easy. My cardiologist put me on this pill. My nephrologist for my kidney put me on this pill. I now have this going on with my eyes, and I've developed a chronic, right? And you have all of a sudden, you've got 6 different doctors managing 8 different medications, but do you have one person quarterbacking that whole team? And that is some of the idea of holism. So I think it's super important that each of your listeners and each of us has somebody looking at the whole picture, because we are not a leg or an arm or a heart. Right. We're a human being. We're a spiritual being. We're here working on some things, and those different factors all come together. So I think recognizing that is a huge, huge important part.
And I think that's what I tell some of my clients is like, if your doctor's not willing to pick up the phone and talk to the other doctor, that's also like, if they just like, oh, we're going to refer you over there, but like you said, we don't have time for that. Like, it's just like, okay, see the next patient. Okay, well, you're taken care of by that doctor now, so you're off my hands. But if your general practitioner, your family doctor, who should be probably the one who's giving you the total advice of everything, because they're seeing everything, like if they're not in it with you, like you need another doctor. Sure. Right? Like you need somebody who's willing to say, okay, I'm going to send you to the cardiologist because they've got that more advanced knowledge about what's going on. But we're going to stay involved in it and make sure that when they send you to somebody else for your kidney issue, that those medications aren't causing side effects that are then going to, like you said, now I've got headaches all the time. Do I need to go see a neurosurgeon, or is it just simply, because of the drugs that I'm on, because of the other issues?
Yeah, I said that's exactly true. And, you can definitely draw a direct connection between, or are they willing to look that, hey, I've developed some changes in my kidney as a result of a blood pressure medication that's job is to be a diuretic or affect the kidney, right? And just simple things like that, you can look at that, or certain blood pressure drugs, work by slowing down the heart and slowing down the heart rate. Well, it's important to know, right? So to understand how those pieces interact, I think, I'm with you 100%. I think that's really great advice that you're giving your clients, to just have some awareness, because I think we all need that. And the more complex the situation or condition going on with each of us, the more vital and necessary that is.
Right. And so, but there are ways to get out of that, the sick care health system.
Yeah.
And become more into the, how do I get into the preventative side of things? How do I get to where I don't have to have those medications, and like, what should we be looking at as far as like, okay, if I have a headache, and not necessarily self-diagnosing, but sometimes it is self-diagnosed. Like, what did I do to cause it? Like, right. Did I have that night out? Did I have, the extreme amount of something caffeine wise or whatever? But then how do we go, okay, well, what's my approach to fix it if it's not Advil or Tylenol?
Yeah, I think, so how do you get healthy? It's kind of the questions, especially when it's called a healthcare system, but there's two issues with it. One is there's no health in the system and there's very little care, right? But outside of that, it's more of a disease maintenance or disease treatment kind of system. Right. Again, there's great people in that system, incredible technology, great knowledge. But, when you go in there for diabetes and they give you a drug to basically kick the pancreas to produce more insulin. Right. That's treating the symptom and can be super useful, or lowering your blood pressure. They give you a drug to do that, can be super useful, but it's not handling the cost. So let's say we have someone who, just like you said, wants to say, so I want to actually work towards health. How can I do that? Right. Well, the first step is you got to actually understand what health is. Right. I think that's the biggest, I think that's the biggest issue, because how do we define health? Some people define it as, well, I don't have any symptoms, so I must be healthy, or I feel fine, right? Whatever fine happens to mean, right? They can feel fine. Yeah. Right. I'll give you one example. On like 50% of the people, the first symptom of a heart attack or first symptom of heart disease is death or a heart attack. Yeah. Right. 50% of the time you have no signs of heart disease before you have a heart attack and or die. So that person, one day before that heart attack, were they healthy? Well, I'd say definitely not. And I think most people would agree on that, but they had no symptoms. Yeah. So I think we really got to define what health is. So that's really what I tried to lay down in the book. Because I think if you can get that in, there's always, we were talking about this, like the tips, the tricks, the latest supplement, the latest things like that. Right. But we almost need like an operating system change. Yeah. Like we just need to actually, because we can't get where we want to go if we don't know where we're going. Right. Like, if I tell you to go to a city, but you've never heard of and have no idea where it is, that ain't going to work real well for you. Right. But the better you know where you're going, the more clearly you can plan out a route to get here. So that's what we attempt to do in this book, is define what health is, and then lay the principles down. And in my experience, 5 key principles towards that. And I think those are like signposts. So when somebody comes to talk to you about something, like if you know the signposts to say, hey, that's moving me towards health, or that's not, then you can make some of those decisions. And then, you're not dependent on, somebody's latest Instagram post or the email, even if it's, mine or yours, telling them what health is, because you have the ability to understand where that is. So the purpose of the book is to define what health is, because when you go to your doctor and they say, hey, nothing's wrong with you, you're fine. Or, hey, your blood work or your blood work looks good, so nothing I can do for you. Or you're like, I'm tired, I'm fatigued, I know something's not right, I felt sick for the last whatever this. No, you look okay to me, blood work checks out. Right. I mean, those are the people who, I think we see a lot in this area of alternative health, and they're frustrated. And you know what? They should be. Right. I mean, it's totally understandable that's where they are. So that's the thing. One of the signposts they can look at to say, yes, this is right. This is on the right track. And how does that play out in my life? Right.
And and you said something there that I'm going to risk like getting in trouble with my wife, but I'm going to bring her up as an example. A couple of years ago, because I've been doing this I was in the corporate world for a while. I've been doing this for 7 years almost now. Okay, cool. And so a couple of years ago, I was like, all right, you know what? She was starting to buy back in, And we both have the same degree. So it's a little bit sometimes of a headbutt, like, well, I learned this and I learned this. Well, we learned it at the same school. So like, but I said, look, you're having these issues. You need to go get your blood work done, and let's like get a copy of it and let's look at it. And so she went in and had her blood work done, and the doctor was like, your blood work's fine. Like, there's no issues. You're fine. And she's like, no, but I've got this and this and this that I'm dealing with. And she's like, oh, but everything's fine. You just relax a little more, sleep a little more or whatever. Didn't really give her any true help with it. And so then I said, okay, well, we need to do another blood test. Go have this one done. And of course, insurance didn't cover it. And so, and the doctor was like, why do you want to do that? Yeah, that's not going to tell you anything. Yeah. And, I think we paid $450 for it. And then we got 2 markers, and I was like, boom, we've got 2 things that were like, okay, that's not where it should be. Yeah. Now we know what we can fix. And it was, deficiencies in just minor areas of nutrients. And so it's like, okay, fix those. Yeah. And now she feels a ton better, and it's like, but they don't, like you said, if everything looks good on the blood work, it's like, okay, you're fine. But it's like, but internally we're really not, because the initial blood work doesn't really give us a big enough picture. Yeah,
for sure. So let's talk about looking good on the blood work, since you brought that up, because I think that's a fantastic area to talk about and super useful. So most lab ranges for blood work are set so 95% of the people are normal.
Right.
So 2.5% of the people are abnormal on the low end. 2.5% of people are abnormal on the high end. So normal, and then for most blood tests, is the average of 95% of all the sick people who get the test.
Right.
Right. Like, how empowered do you feel knowing that? Right. And I'll give you one specific example, and this will be familiar to probably many of your listeners, or at least they've heard of it, especially the women. It's called TSH. So TSH is thyroid stimulating hormone. And this is, if your doctor does one test for your thyroid, it's probably this one.
Right.
And TSH is produced by the pituitary, which is in the brain. And it's the one that tells your thyroid, hey, start working,
Right.
So basically, with a high TSH, it means your thyroid's low. So it means your brain has to yell to get your thyroid to work. So high TSH, low thyroid, and then low TSH means high thyroid. So anyway, it's a little counterintuitive, but that's it. So the reference range, I say that all that to say, the reference range for TSH, thyroid stimulating hormone, is somewhere between 0.4 and 4.5, depending on the lab, give or take a tenth or two.
Yeah.
But it's 0.4 to 4.5. So how useful is that? Imagine, for those of you who got kids, imagine your kid comes home and you ask them, how was your first semester of college? And they say, I've got a GPA somewhere between 0.4 and 4.5. Right? What do you know about your kid's first semester? You know nothing.
Nothing. Yeah.
He probably has a pulse and is still alive, but outside of that, you know nothing.
Yeah.
Right. And that's the example I give for that TSH. So, there's an optimal range. So one thing we look at, and I encourage, all your listeners to do this, or find practitioners that do that, is we tighten ranges for dozens and dozens of blood tests down to optimal ranges. So even though it's quote unquote normal, is it optimal? And for TSH, the number I like is somewhere between 1 and 2. That to me is an optimal level for that. So that way we can look at and say, hey, the doctor says I'm normal, but you're at 3.5. Well, that shows me we're on the path to a hypothyroid. Right. Maybe not fully there clinically yet, which is certainly good. Yeah. Right. But it shows us where we're at now, and maybe the path we're on, so we could do something about it.
Right.
And you can do that for a whole bunch of blood work. So blood work's either set that way, or it's set to be able to put people on a lot of medications, which is what the cholesterol numbers come from. Right. So when so back in, I think the first cholesterol drug was on the market, I think it came between 84 and 86. Mm-hmm. So just before it came on in 1984, I'm late 30s. So the high range for someone my age was 345 or so. Okay. So that was lab high for cholesterol 40 years ago. Now lab high cholesterol for someone my age is 200, depending on the lab. Oh, wow. So what changed since then, right? And how has that number consistently come down? I've got a strong answer, and it's the first group that set those blood recommendations for cholesterol levels. There's 9 people on it, and 8 of them were paid consultants for the drug companies, and then they've consistently lowered it since then. So we have to look, in the cholesterol example, cholesterol, 25% of it's in your brain.
Yeah.
Well, so that seems interesting. So it doesn't seem like it's all bad. So cholesterol is vital to brain function. And that's why one of the side effects of cholesterol lowering medications is dementia, or not really dementia, but memory loss, brain fog, things like that. Right. It's 100%. You make vitamin D from cholesterol. They don't tell you that, but now we have a bunch of people on cholesterol lowering drugs. And guess what? They're also vitamin D deficient.
Right.
It's vital for the digestion of fats in the body. So your gallbladder function, you need cholesterol to do that. Every single cell in your body has cholesterol. So without any cholesterol, you're dead now.
Yeah.
And then on top of that, every hormone, testosterone, estrogen, progesterone, the anti-aging hormone, DHEA, and some other hormones are all made from cholesterol.
Right.
And oh, by the way, there's a rare genetic disorder where people can't make cholesterol. And guess what? The symptoms mirror autism. It's like Smith-Lepitz-Opitz syndrome. It's a congenital deficiency where you can't make cholesterol. Your number's under 140, and they basically develop autism-type symptoms. Okay. So this cholesterol molecule that's been vilified is actually vitally important for the body. So we can understand that. So does that mean having too much cholesterol in your arteries is good? No, not necessarily. But it means we have to understand why it's there. And the analogy I like to think for cholesterol is, cholesterol in the arteries is like having ripped jeans and you have a patch over it. Is the problem the patch, or is the problem the fact that the jeans are ripped?
Right.
Most people say, oh, the problem's the fact that the jeans are ripped. And that's what cholesterol does. It's the patch in that area. So we got to find out what's weakening that artery, whether it's sugar causing inflammation in the diet.
Right.
There's a specific fraction of vitamin C, specific bioflavonoids that strengthen up the blood vessels. So anyway, we can look at different things like that to think through, what's there. And, just to finish that thought on cholesterol for patients out there, you can look at the particle size of the cholesterol, and that's much more indicative of actually a true cardiovascular risk factor. You can look at HDL. That number matters to me. HDL is what your doctor might call your good cholesterol. That number over 65 would be very important. Just to give a number. And then I like the triglycerides. I think that's a useful number. Lab range is typically under 150. An optimal range for me is somewhere between 70 and 100. And one of the most powerful factors towards that is sugar and refined grain consumption, which feeds through to triglycerides, which are fat in the blood, which can feed through the cholesterol. And then you can look at, other factors that impact cholesterol. Like if somebody has, going back to our thyroid example, if somebody has hypothyroid, they tend to have higher levels of cholesterol. And that's just one about 7 or 8 underlying reasons for it. So again, it's one number, and the medical solution is take a statin drug for the rest of your life, maybe.
Right.
But it's actually, one, it's vitally important, the cholesterol, and two, is it's telling us a story. And if we can understand what that story is, we can actually use it to become healthier instead of just treat the symptom, and which may or may not even be a symptom in this case. Right.
And it's so funny because there's, like, I remember going when I had to switch doctors, 4 or 5 years ago, because of insurance switching. And so I was like, my current one wasn't in plan anymore, so I needed to switch. And so the guy I go to, he's a good friend of mine. He goes to my church. Like we know each other. He knows what I do. He knows me. I had just gotten blood work done at the other one, like, I don't know, 3 or 4 months before. And so I went in for the initial visit with him. This is pre-COVID and all that. And, but the nurse didn't know who I was at all. Right. No idea who I am. No idea what I do. And I'm sitting there and she goes, okay, well, let's look at your blood work and da, da, da. And she was like, what about, like family history? And so she's looking at it and she's like, okay, well, she goes, any heart disease? And I was like, grandparents. And your parents on any medication? I said, my dad's on cholesterol medication. She goes, oh, okay. And you're mid 40s. So, okay, we're going to have to look at you for cholesterol medication. And I was like, no, you don't. And she was like, oh no, it's hereditary. It's guaranteed. You're going to have it. Yeah. And I was like, no, don't. And well, so he comes in, afterwards. Of course, she wasn't there, unfortunately, but I told him, I was like, you might want to tell her. He was like, dude, you have the best cholesterol numbers in my entire practice.
Wow.
He goes, if I had everybody that had your numbers, I'd see fewer patients in a day.
Yeah.
And so I was like, but a piece of that is, though, like you were just saying, there's so many different reasons it could cause these issues. But if they're so set on oh, well, if this is it, you're stuck. This is what you're destined to have.
Yeah.
Like I said before, you need to find a new doctor, a new physician, because it's not supposed to be that way. That's tunnel vision following into like you said, everybody's into this range.
Yeah.
So it's
one size fits all.
You're stuck. And it's really not that way. It's really finding, really what I like to say is like more of a tailored medicine to you, like tailored to like what's really going on. Have somebody that's going to spend time with you, because then they're going to find out like, okay, well, this life change that's happened for the last, 3 months has driven all your numbers up. Well,
yeah.
How do we address that life change?
Sure.
To then be able to get the numbers back down.
Sure. Yeah. No, that's a phenomenal question. I tell patients that like, yeah, and I think you can see that, if somebody thinks, well, that might be, every effect has a cause. That's like a real clear rule. And I think it's like everyone would do good to write that down and like tattoo it on their head, or, tattoo it on their doctor's head, depending on what they think of the guy or gal they go see. Right. But every effect has a cause. So if all of a sudden you don't have high blood pressure, then all of a sudden you have high blood pressure. Guess what? Something changed.
Yeah.
Right. And what changed wasn't a deficiency of the drug that all of a sudden you magically developed. Right. There's every effect has a cause. So if you can look at when did that symptom begin and really be honest about change in lifestyle, change in diet, change in stress level, change in job, change in activity level, right? Sometimes there's a lot of things to work through, and having a great practitioner to help you through that, or, somebody to guide you through that can be super helpful. But every effect has a cause. And, if all of a sudden, if we see a plant that's all of a sudden starts to die, and all of a sudden the leaves get a little brown, we don't wonder what happened. We say, okay, does it have the water? Has it gotten the sunlight? Oh, wow, the shades have been closed. Let's open the shades, right? We go back to what it does that create help. We don't think, hey, let's diagnose this as brown leaf itis, give it a fancy name. Let's spray paint it green and, or just, do a tiny plant surgery to, remove the brown part, It's just like, hey, this is a sign something's not right in this plant. How are the nutrients? How's the soil? How's the sun? How's the water? And let's nurse this thing back to health.
Right.
There was a gentleman, his name is Roger Williams. He was at the University of Texas, so not too far from you. And he wrote a book called Biochemical Individuality. So big title. Right. What does it mean? So this guy he discovered two of the B vitamins. So there's like, a whole, we know up to B12, and there's a couple others that go. Yeah. So he discovered two of them. And I think his brother discovered a third. So this guy's big time in the area of nutrition, right? And biochemistry. So he wrote a book called Biochemical Individuality. And this idea and this principle in the book he wrote helped me understand a question that I, struggled with or wondered about a while in my practice, which is, how come I see some patients that, need support from B vitamins or calming minerals or, whole food vitamin C or whatever the herb or supplement happens to be.
Right.
Or they need to be adjusted every X amount of time. And other people just don't seem to have that need. Mm-hmm. And what he said is individual nutrient requirements can vary 100x person to person, 100 times. So if you need 10 milligrams of something, somebody else could need 1,000 milligrams of something. Right. And it's, and it was just fascinating to me that he done. And then he goes through the study. But if you look about it, right, you're not the same size I am, right? You're not the same size as your doctor. Some people could be 150 pounds more, and some people can have twice as much muscle, and some people can be bald, and some people can have big feet, and some people can have, and then you even look at, there's different configurations of the hearts and the blood vessels, and the size of someone's stomach can vary 6 times, so you start looking at all these things that make us unique. Well, there's some general principles, but of course, the amount of stress someone's under. So I'll give B vitamins as an example, because there's 4 things that greatly increase the need for B vitamins. One is sugar consumption, right? We need B vitamins to help us process sugar. So if somebody who eats a lot of sugar, they're going to be deficient in B vitamins. A second one is alcohol consumption. So we need B vitamins to detoxify alcohol. So that's 2. Third is stress. So somebody under a lot of stress. So just, it's like you drive your car, you just redline your car for a while, you're going to need to take it in for maintenance a little bit more often, right?
Right.
That's kind of what stress does. And the final one is long distance or endurance exercise.
Yeah.
Things like marathon, ultra marathon, right? There's kind of a tax, whether it's cycling or whether it's running or whether it's swimming, but there's, you burn up more nutrients, just like you drive your car around the whole US from here around, you're going to go through more gas, you're going to go through more oil. So anyway, he was able to look at this, and to me it answered, and we saw a practical example of it. And the example I give, we saw a real practical example of this during COVID, because all of a sudden everybody started talking about zinc, right? The nutrient, you never really heard people talking about zinc, except, in the fringe alternative health community, they'd say, oh, zinc's good for a cold. But all of a sudden during COVID, it's like people started losing their taste and smell, which is classic zinc deficiency. So if you just take us out of COVID, that was not really a COVID symptom. That's a classic zinc deficiency kind of syndrome.
Right.
And then, zinc, for example, inhibits viral replication. So now it kind of makes sense how a viral disease like a COVID might inhibit zinc production. And that's why you saw a lot of recommendations to take zinc or prevent it with zinc.
Right.
And then further, we saw women, I think a stat I saw was women started losing their hair after COVID. And, I think the stat was around 30% of people experience kind of transient hair loss. So maybe a month or 2 or 3 after COVID, hair starts to come out, thins out. And for most people, it would clear up 6 months later, or 3 to 6 months later, and kind of depending. But for any people out there listening to that, that's 95, 97% zinc is the key mineral to look at, especially if you lost your taste and smell during COVID. I really encourage you to look at your zinc levels. So you can do that from food or supplementation. But that's an example of when somebody has COVID or any kind of viral issue and doesn't, their zinc needs are changing, right? And drastically from 2 days earlier. Right. And it's like that for zinc. It's like that for vitamin C. It's like that for B vitamins. It's like that for manganese. Right? It's like that for all sorts of different things, because like you said, we're not one size fits all Model Ts, that famously you could get in any color that you want. You can get a Model T any way you want, as long as it was black and it looked exactly like all the other ones, right? For a lot of the time, right? But just human beings aren't like that. So if we have to really create health and help others create health, we have to recognize that truth and see the uniqueness of ourselves, and each person has that own unique journey there.
Well, and that's you talking about B vitamins and endurance athletes, because that's me, right? Like I'm in there at the 45 miles a week usually.
Good for you.
And so it's like, I know I take a super B complex and also a B12. On top of that. And so it's like, because I know I'm just pounding it out. But what I feel, like if I take a week off from running and exercise, just like a recovery week, not necessarily from an injury or forced or anything like that, but like a planned, because injuries, that deals with that, you get stress involved and all that kind of stuff. But like, no, this is planned. Whether it's going on vacation or just like, I need a break. But if I don't adjust my vitamin intake at the same time, like I see massive energy spikes, and like, because it's like, oh my gosh, I'm taking on this B vitamin and it's and I'm not burning it off.
Sure.
And it's like, oh my gosh. And it affects my sleep, and it affects, and then like, that starts a whole nother chain reaction but it was things I was doing for a good reason, right? Like I'm doing these things for a healthy reasons, for a good reason. But when I change my workload, my body reacts to that. And if I don't adjust the input, then I think the same thing happens with with athletes when they retire. I mean, I know this happens when I do take a longer break, whether it's an injury or whatever. It's like, if I take a 3-month or 6-month break, it might take me a month or 6 weeks before I actually really truly adjust my food intake. Because you still got that craving, you're still feeling like I got to eat all the time. So you see athletes that retire that all of a sudden, like, you look at them 3 months later and you're like, oh my gosh, they gained a lot of weight. And it's the workload, yes, but it's like that drive to eat was still there. And I think that's something that a lot of people don't realize how ingrained that is when they try and make a change for the positive, that negative is so ingrained. And some of it's obviously chemical created in addiction and that kind of thing, but a lot of it is just habit. So how do we look at that nutrition wise and like really get into that mind focus of like, how do we change that habit?
Yeah. So I think it's a really great question. Just to pick up a couple of threads you touched on there, and then we'll kind of answer that. So the term is, so specifically what you see with endurance athletes, you can, not always, but you can, the tendency is for what's called exercise-induced cardiomyopathy. So big term, exercise-induced means caused by exercise. Cardiomyopathy is typically like an enlargement of the heart.
Yep.
Anyway, that's the B vitamin. That's the thing there. So you can also do that with foods rich in B vitamins, so nutritional yeast, beet, sweet potato, liver. Those are some phenomenal whole food sources of B vitamins. But yeah, and then you talk about athletes that retire. It's like, so I think, optimally, I think we could learn a lot about diet by watching, animals eat.
Right.
They don't read books on it. They don't study nutrition.
Right.
We can also see it when we look at kind of the hunter-gatherer kind of diet, or more of like a historical, like more native peoples around the world. And what you see, there was a guy named Weston A. Price, and he was a dentist, and he literally wrote like a 700 or 800 page book on dental disease. Wrote about, all the stuff. This is in the early 1900s, 1910, 1920. And he wrote about all the types of things that can go wrong with the tooth, basically.
Right.
Wrote a book on disease, 800 pages. And then his son got dental disease, got a cavity. And he said, okay, so I know all the stuff about the disease of the tooth, how to diagnose it, how to name it, how to look for it, what to call it. He said, but I don't know how to keep teeth healthy.
Yeah.
Right. So he had that like major epiphany. Like I literally wrote the book. I don't actually know what health is, which is kind of where we started this conversation.
Yeah.
So what he did was traveled around the world and visited native cultures. So he went to the Inuit in Alaska. He went to the Highlands of Scotland. He went down to the Maori in New Zealand. He went, I think we saw a couple different tribes throughout Africa. I think he went over to India as well. But so he traveled the world, which was, quite a feat in, the early 1900s.
Yeah, that era, yeah.
And he looked at that, and what he found is people eating their native diet had 3,000 times less incidence of tooth decay.
Oh, wow.
So, and then what he said, and then he goes, well, maybe it's just genetics.
Right.
So then he looked at some of their kids who would go into the cities or go off to the equivalent of college or get a job. And what he find is, within a few years of them being in a city or more, quote unquote, civilized life, their rate of tooth decay would equal out the people who are not living that way. So basically you have a, industrial diet, you go right back to that 3,000% increase in tooth decay.
Right.
So what did he learn? So what he learned through all that, what he learned was there wasn't like a specific magic diet. Like the Inuit up in Alaska, it's like 90% beef and or fish, meat, animal fats, right? Very little vegetables or fruits, right? Not a lot growing up there. So, but then, he looked at cultures that were largely agrarian or hunter-gatherer. And then, you look at some were more fish-based, some were more meat-based, some were more, nuts and seeds and vegetarian. So you saw tremendous variation in the types of foods they ate. Okay, so how does this impact us now? And how does this answer your question of like, what do we do about it?
Yeah.
I think all of us have this inner wisdom and understanding of, have you ever eaten something and felt better when you ate it? And have you ever eaten something else and felt worse when you eat it? Yeah. Right? Animals do that instinctively. Humans do that instinctively when we're not run by advertising and, the smell of chocolate chips from the other room or whatever the case may be. But we have this inborn intelligence and wisdom. And, for a lot of people, we have to recultivate that. And the way I'd start with someone is each time just having the awareness of, okay, what foods do I feel better eating? And just beginning to cultivate that awareness. And which foods do I not feel as good when I eat? And just being able to make slow steps towards that. You'll begin to cultivate that, because I and there's certainly some principles to eat, and we'll certainly talk about, those in the book. And, they can, I'm happy to continue the conversation on Instagram or people after. There's certainly principles. There's certainly like foods to eat and not eat, but there's, even more than that, this understanding that, those cultures 100, 200 years ago or thousands of years ago, they weren't reading books on diet and nutrition and reading the latest study and blah, blah, blah journal.
Yeah.
Right. It was this intuitive sense. And what we know is, you know, every environment in the world had all the nutrients needed to create life. Why? Because life was created and sustained.
Yeah.
Right. It's almost a self-fulfilling thing. And so they looked at, so there was a piece of research, maybe about 10 plus years ago, but they looked at different people, different, groups eating their ancestral diet. And they saw each of them had between 2 and 8 times the RDA for all the nutrients needed. Oh, and they looked at the, standard American diet, which is abbreviated SAD in SAD quite appropriately. And they looked at, it had about 20 to 80% of the recommended nutrients. So the standard American diet, grossly deficient. Yep. The native diets or more than ancestral diets were abundant in the nutrients they needed. So so how can we apply that? So simply the closer we can get back to whole foods. Right. So not necessarily the grocery store, right? But just foods that are whole. Right. So what's an example of a whole food? An apple. Yeah. A fractionated food would be apple juice, or apple juice sweetened popsicles would be an extension of that. Right. Right. Or, the most extreme example of a fractionated food would be white refined sugar. Mm-hmm. Right. Most of us know that's bad. Well, where does it come from? It comes from sugarcane. Yep. Well, if you get sugarcane and you chew on it, it's 90% fiber. Right. And guess what? It's full of B vitamins, it's full of zinc, and it's full of all the nutrients you need, manganese and others, magnesium, to be able to digest it. And guess what? The fiber mitigates the negative effects of sugar. The B vitamins, we said you need more when you eat sugar. So if you eat it in its whole food form, you naturally get everything that's needed. So the closer we can get back to eating food as it's found in nature. Yeah. Right. And less away from stuff that comes in a box or a can, or certainly out of a drive-through window. The more we're honoring that principle of holism, and the more we're reflecting that answer. So, I think those are some really important principles to think about.
No, and I that's one of the things I tell people is like, if you, obviously, I think most people have heard, okay, if you can't read the ingredients because, the chemical formula or whatever it is so crazy, like that should be a sign.
If you can't pronounce it, don't eat it.
Right. But the other thing is like, if you're going to buy something that's made with apples, and it doesn't look like an apple, it's not a whole food. Like, right? Like it's got to look like an apple. It looks like a blueberry. It looks like that's, and I know a lot of people are, obviously there's the organic and non-GMO and all of that. And those are pieces of it. But what I tell people initially is like, if you're on the SAD diet, like don't stress yourself out with, now I have to go all organic and all this. I have to shop at the local farmers market and is that great? Absolutely. Yeah. But the apple from the grocery store that you just pick off the shelf and don't even worry about where it came from or what is going to be healthier than the food from the drive-through menu or the packaged box. And so it's like it's a baby step in the right direction first.
Mm-hmm. I think that's really important. And sometimes a way to bridge the gap is, focusing on what they can add versus what they can take away. Like you said, so maybe you're running late and you're going to work. Well, let's have an apple on your way to the drive-through, or let's focus on a healthier option when you're there, or let's just have a good breakfast. And, obviously, you can get a couple eggs, price has gone up recently, but fairly reasonably for a couple eggs or 3 eggs. And if you get some good quality eggs, farm fresh eggs, I mean, that can go a long way in at least getting one good meal. And so sometimes it's easier to focus on what to add. Another thing is I think about 70% of all the sugar someone consumes, they drink.
Oh, right.
So you think about that. So of all the, all the candy and all the sweets and all that sort of stuff, that all makes up 30%. So 70% comes from what we drink. So that can be another way to start, was you still have your candy bars and your cookies and things like that, but let's cut out the soda, the sweet tea, the Gatorade, the things like that. Cut out the sugar we drink, or have one less a day and work on that. So there's a couple different ways you can kind of do, like you're saying, to meet people halfway and kind of make some of that progress.
Right. Because it doesn't have to be a cold turkey, complete change on, January 1st, because as most of us know, those things don't work. Yeah. And it's not because it's not because going healthy doesn't work. It's because it's too big of a change and shock on your body too quickly.
Yeah.
Because your body revolts, right?
Sure. Absolutely. Yeah. one, it can be tough to maintain, which is what you're saying.
Yeah.
And two is some people can have side effects of changing their diet that quickly. Yeah, absolutely. It can be a tough 2 to 4 days or longer, depending on how addicted someone was to their coffee or sugar. And yeah, absolutely.
Yeah, because that detox piece is tough. I mean, it's sugar is just as hard to detox off of as like alcohol and drugs. Like it's, if you're consuming enough of it and you try to just go off of it completely.
Yeah, I think there's some stat I'm trying to remember is hundreds of times more addictive than certain drugs. So it can be, yes, incredibly powerful when that gets triggered.
And that's the refined sugar, right? And so like, because I know I've had people come to me and say like, oh, my doctor told me no sugar, no fruit, no this. And I'm like, what? Like, yes, there's fruit and sugar, but you sort of mentioned this before, is like the fiber content helps your body understand like, this is what I want to use and I can use and I know how to use it.
Yeah.
Versus, 30 grams of uber refined processed sugar that your body goes, well, okay, I'll absorb it and it'll go somewhere. And, you'll feel the high and the crash because of that, because it's an inefficient way of doing it.
Yeah. And it's a lot harder to OD on blueberries and lemons than it is on sugar. And sometimes you do see people substitute and they're eating, what kind of fruit are you eating? Well, I'm eating nothing but pineapple and papaya and just all the sweetest stuff that's there.
Right.
And in that case, I'll just try to, like, a general rule of thumb is just, let's aim for twice as many vegetables as fruits. Right. I think that's a really great way to go. Or just try to skew a little bit more towards the lower sugar fruits. So things like lemon, lime, avocado, blueberries, those are some ways to go versus someone who's having dates and figs and pineapple and things like that. Yeah. But in general, even if we're ODing on dates and figs and pineapple, that is infinitely better than the refined stuff that comes out of the store. Yeah,
exactly right. So how can we get your book? How can we get in touch with you? If somebody's got more questions and wants to have that conversation.
Yeah, thank you. I'm super happy to continue the conversation. So the book is Timeless Youth. It's YOU with a little TH, and it's a play on that all healing begins with you. Or the most important truth in your health is you. So what this is a roadmap, like I said, for that patients that are struggling like I was back then, that are looking for answers, that are grasping for straws, or have someone in their life who is going through that, who's seen all the doctors, quote unquote, all the doctors. And they've got, oh, well, I think everything's okay with you, or I think you're fine, or, whatever they've told them, but you just know deep down your gut, something's not right. So this is that book. So Timeless Youth, you can find it anywhere books sold. It's on Amazon. We have a website, timelessyouthbook.com. So you can find it there. Cool. And probably the easiest way to continue the conversation is either through that website or on Instagram. My name is Jeff Crippen, JEFFCRIPPEN. And we've got some recipes, some food, some health tips that we post there a few times a week. And we can certainly continue the conversation. You can message me directly and I'll be happy to get back to you on that.
Awesome. Well, I like I said, I'm reading your book. And so I don't want to spoil the ending, but I'm assuming that you're headache free and have been for a while.
I have, and luckily it's, knock on wood, it's been that way for the last 10 years or so. And, and now at the point where when I do get a headache, I often can spot why pretty quickly. Yeah. So it's like, but it's nothing like, at that point where, nonstop for 2 years. I mean, it was literally every moment, every day for years. So it was like, thinking or taking one step would cause the pain to work. So now, I'm not doing 45 miles a week, but I certainly enjoy 1 or 2 10Ks a week. And, I feel super happy with a couple 6-mile jogs. So getting up 12, 15 miles a week and, just be able to run and be able to play tennis and be able to, be busy doing what I love to do. So, this is the journey I've went on. And for the last 12 years, this is the journey I've mentored patients on, and you learn a lot going through it yourself, and then as you learn a lot more trying to communicate it and help people each and every day understand it, apply it, handle the pitfalls, handle the difficulties, handle the confusion, handle the mistrust of the family members or whatever else comes up as they go through that journey. And that's kind of what I'm trying to encapsulate in this book, and that's what we're working on through our work here and through that Instagram.
Yeah. Well, you're doing a great job. I applaud you for it. And I think that like you said, it is hard, but it's easier to relate to somebody that's been through something like that,
Yeah.
because I think a lot of people don't understand that they feel bad every day because they don't know what good feels like anymore because of, their diet or their medications that they're on, and so it's like they're 2 years or more into, I feel bad, I don't know what good feels like anymore. And like now, like if they can get to where they feel good, then when they have that moment where they feel bad, they'll realize it and go like, okay, what did I do? How did I trigger this? And it could have been something that was perfectly fine and no big deal, but like to be able to spot that and know it versus not, and just being able to just being in that chronic stage is what I'm trying to help people with. And it sounds like you're doing a great job of doing that as well.
Yeah, no, I think that's awesome and well said, because sometimes when it's easy. I mean, I've seen patients there. It's easy to get so beat up,
Yeah,
that you don't realize what good is again, or or you're just so far away. It's just frustrating or depressing to even think about.
yeah,
Right. And then what's even the only thing more frustrating than being stuck in that, what I found working with patients, is the one who work through, get 80-90% of the way back, and then they have a setback, and they don't go all the way back to zero, but they go back to maybe 20, 30, 40% of where they were.
Yeah.
And then the pain at that point is actually more frustrating than where they were at the beginning, because it's like you get the taste, you get the glimpse, and then you get the sucker punch to the gut with that symptom coming back. So I mean, certainly, certainly going through that and having a journey through that, I think gives me a tremendous amount of empathy and understanding of what they're going through. And I've been there, I've done that, I've made a bunch of mistakes, and but learned a ton along the way, and then had the opportunity to help others, and kind of see them win and see what works, and have fun in the process. So anyway, it's been a real blessing and a joy to do that, and appreciate being on today and be able to share some of this with your audience, and I hope that it helps them and empowers them going forward. And if they want to know more, we got the book and we got the Instagram to continue the conversation.
Good deal. Well, thank you so much for being a guest, Jeff.
Awesome. It was a pleasure. Thank you so much, Jerry.